it's always good to kind of look at the scorecard and tell you what you need to do to change the gameplay. And basically, when you look at the top 17 industrialized nations, the United States ranks 17th in lifespan for women and 16th in lifespan for men. But then when you look at the entire world, all 204 nations in the United Nations, we rank 92nd in healthfulness. There's 91 other nations whose peoples are healthier than us. We rank 60th in longevity. There's 59 other countries whose peoples live longer than us. God forgive us, we rank 41st in live births and first month survivability of our babies. And then, again, according to the U.S. Health and Human Services Office of Inspector General, which is the auditor for Medicare patients, they say that doctors kill 15,000 Medicare patients every month in hospitals. Doctors kill 15,000 Medicare patients every month in hospitals. That's 180,000 a year. I mean, if you're a Medicare patient, you wouldn't tolerate that for airlines. You'd say, honey, they kill 15,000 Medicare patients in commercial airlines every month. Let's take Amtrak. And then, according to the Center for Disease Control, each year in America, medical doctors infect people who come to hospitals without infections. And doctors, because they don't wash their hands after they go potty, they infect you, and you get 2 million infections, of which 90,000 die each year. That's a yearly figure. 90,000 Americans are killed each year just because doctors have dirty hands in hospitals. 90,000. Now, what if Iran were to send over one of their ballistic missiles, a nuclear warhead or a biological warhead, that would infect 2 million people and 90,000 would die? We'd declare war on them. We'd go over there and we would just destroy them. We wouldn't be handing out chocolate to the kids hoping to win their hearts and minds. We would just destroy them. Well, here we have one trade in America who have legislated themselves into a protected monopoly. They're the only legal monopoly in America is the medical system. They've legislated all their competitors out as quacks and frauds and so forth. And as a result, they can kill, burn, maim, and rob with impunity, and nobody seems to care. Then you keep looking, you keep digging, and let's just, they always complain about all those dirty vitamins and minerals killing people. Well, in 2007, there were 600 complaints to the FDA. 600 complaints from consumers call up and say, I got diarrhea from taking too much vitamin C. I had a rapid heart rate and itchy skin because I took too much vitamin B3 and so niacin. And so I'm upset about that. Well, that same year in 2007, the calls in for pharmaceuticals for prescription drugs was just short of 500,000, all of which were killed. These are people who, their families, the doctors called in and registered a complaint because somebody was killed by a drug, a prescription drug. There's 487,152 or something like that. And it was in fine print in the same article where the 600 complaints about diarrhea and itchy skin for vitamins and minerals are the big headlines. And so here's where I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. That's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Believe me, petitions to the medical system aren't going to help. Petitions to the government aren't going to help. They're too busy squandering your tax money, right? And so what we have to do is take the time to learn how to take care of ourselves. And I haven't been to a doctor with me being the patient in 65 years. I have never been on a prescription drug. If everybody in America were like me, guess what? The medical system would be real humble. But the fact that everybody is sick and 54% of our kids are on prescription drugs, 54% of our children are on prescription drugs. I'm talking about under the age of 18. This is an absolute crime against America. Absolute crime by one trade, one profession, and nobody seems to care. Insurance pays, and of course, when they used to say if they didn't know what the disease was, they'd say, oh, you got chronic fatigue syndrome, and of course there was a code in the insurance book that would pay for it. Well, now they found out that Lyme's disease code pays more than for chronic fatigue syndrome, so now everybody who has a disease that doctors don't know what you have, it's Lyme's disease. I get people tell me, Doc, oh, I've had Lyme's disease for 20 years. Really? Well, Lyme's disease is a curable disease. It's caused by bacteria. It is a close cousin of the syphilis bacteria, which is killable in 2 weeks with penicillin. You can kill the Lyme disease bacteria in 2 weeks with an antibiotic. If you're being treated for longer than 2 weeks for Lyme disease, it means your doctor doesn't know what you have, and it is likely to be something as simple as gluten intolerance, got itchy skin, sore joints, you have chronic bowel problems, and they've already taken out your gallbladder and everything else. They say, well, the only thing left is Lyme disease. Well, that's because the code in the code insurance books pays very well for Lyme disease. Okay? And it's absolutely a crime. In fact, the insurance companies should be watching that. Anybody who's treated for Lyme disease for longer than 2 weeks, especially in a doctor's office with IVs, and I really feel good after my IV, but then in 3 days I'm depressed again. Okay. Get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport to Aromatherapy. And the only time you're going to need a doctor is when you're run over by a concrete truck. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, this is one of those ones. Actually, we should probably get this out of the way right off the bat, because this is something you've been talking about and we've been discussing on this radio show for a number of years, and that is these unnecessary and unneeded procedures and treatments and tests that are often done. Nothing more really than to pad the doctor's bill, or because they're afraid they're going to miss something and then they'll get sued. But this Fox News story's headline, "Just Say Don't." The doctors question 135 routine tests and treatments. Say now there's 135. That's how many medical tests, treatments, and other procedures, many used for decades, now identified as almost always unnecessary and often harmful, which doctors and patients should therefore avoid or at least seriously question. And they've started a new thing. It's 17 of these medical societies, these medical professional societies, ranging anything from neurology to ophthalmology to thoracic surgery, have all banded together in a campaign that's being called Choosing Wisely, organized by the American Board of Internal Medicine's Foundation. And it's aimed at doctors to try and get them to stop performing these unnecessary procedures, but they're also wanting to get it out to the patients. So they, because I think they've already figured out that the doctors aren't going to stop padding their bill. So they figure if they get the patients educated, much like we've been trying to do for a number of years, and they can maybe get the patient to say, no, I don't want that test, or no, I don't want that procedure. And according to Dr. Glenn Stream, he's a family physician and on the board of the American Academy of Family Physicians. He says his group has identified 10 unnecessary procedures. He says, but there are a lot of things that are done frequently but don't contribute to people's health and may be harmful. Goes on to say that the American Academy of Pediatrics physicians say they should question CT scans for kids with minor head injuries and or abdominal pain because it usually doesn't improve the diagnosis and raises the risk of giving the kid cancer. And according to Dr. John Santa, director of the Consumer Reports Health Ratings Center, says for the most part, the medical specialty groups did not consider cost when they made up this list. If their advice is followed, however, it could save billions of dollars a year in wasteful spending. One large group that looked at it, a group of 300,000 patients, they calculated that following the Choosing Wisely advice for just 2 of these procedures, that would be EKGs or electrocardiograms and bone density scans, it would reduce its billings by $1 million a year. They say nationally that would translate to $1 billion with a B a year. And that's just on unnecessary treatments, like giving somebody that's got a viral infection, antibiotics, which it won't work.
Exactly. And of course, a lot of these things are dangerous. They say CAT scans are just loaded with radiation, so you don't want to be giving those to little kids in their brains. Not a good idea. And when they put kids in a hospital, they're likely to get infections, right? And so, especially kids, they tend to be not so clean, not so hygienic. And it's really tragic. When you look at mammograms, there's a big one. That just came out in November 2012. And they said 31% of all mammograms that are positive or false positive, that amounted to 1.3 million women who got false positives in the United States were under age 40 for mammograms. They had their breasts removed. They had chemotherapy and radiation. They were all false positives. The worst year for false positive tests for mammograms was 2008, where they had 70,000 false positives, 70,000. And, of course, they never notified the women that they were false positives. They just put them in the cure line on the charts because, of course, they didn't die of cancer. And so they got 70,000 cures, which were really false positives. So thank you for bringing that up. And, of course, we will continue to persist on Dead Doctors Don't Lie, protect the American public from the doctors who use the patient as a ATM machine. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Michigan. And Patricia, you're on with Dr. Wallach.
All right.
Hello, Patricia, you're on the air.
Hello. Thank you. Good afternoon, Dr. Wallach.
Hi. How can I help you?
Blessing. Yes, sir, I'm calling. I had a stroke in 2009. As a result of the stroke, it affected the left side of my body. And I'm calling I started the 94 Life program. It's been very good. It's almost time for me. I've just about run out of everything. But my question to you, sir, the way it was explained to me, because there was bleeding in what happened, sir, I had a blood clot that formed in my leg. And I had surgery to remove the blood clot, but I ended up having an emergency craniectomy.
Okay. That was to get a blood clot off your brain?
Yes, sir.
Mm-hmm. Okay. And so are you at home now?
Yes, I'm at home. Yes, I'm doing well.
Okay, good. How much do you weigh?
I weigh 217, sir.
270 or 217?
217.
Okay. And how tall are you, dear?
I'm 5'5".
All right. Now, you've bing taking the product, the Healthy Start Pack, for 1 month or 2 weeks or what?
No, it'll be, so it's almost 2 weeks now. Yes.
Okay. All right. And do you feel like you've seen any benefit at all?
Yes, I feel good. Not
okay,
so
good.
tight.
All right. Well, what I would suggest is, you obviously want to order your product because it's going to take you 3 to 5 working days to get it to you. They're in Michigan. And then you want to get an auto ship so it just arrives. That'll save shipping. You don't have to pay shipping. It'll save you another 8% if you get on auto ship. Now, with that said, there's 2 things that I would add to the Healthy Start Pack with your history of stroke. One would be the nightly essence. It's a wonderful enzyme, but one of the enzymes in there is called nattokinase, and it's legendary for being able to actually digest blood clots. And so I would have you take 3 of those at bedtime. There'd be 1 bottle a month of the nightly essence at bedtime with a glass of water. Go ahead and take 3 of those nightly essence enzymes and raise the nattokinase level in your blood. And then I would also take what we call ultimate daily tablets. I would add the ultimate daily tablets. I would take 3 of those ultimate daily tablets twice a day, 3 at breakfast, 3 at dinner. And they are designed to support and promote healthy blood flow through blocked blood vessels, arteries, and veins, and also they're designed to support and promote healthy blood pressure levels. Now, you need also to lose some weight here. At 5'5", 217, I'd like to see you down to like 140, 150. It'd be like almost 60, 70 pounds. Hang on. When we come back, I'll show you how to do that, too. We'll be back after these messages. Okay, Doug, we're going right back to Michigan and Patricia. Okay, we got you going on just about everything, except I want to make sure there's no ongoing damage. That means you need to avoid fried foods, processed meats, nitrates and nitrites, oils, things like margarines, mayonnaise, salad dressings, cooking oils. If you eat canned fish, they got to be packed in water. Mustard, tomato sauce, not oils. And then if you have any skin problems, dry skin, eczema, dermatitis, or a history of respiratory stuff, I would also get off of gluten, no wheat, barley, rye, and oats. And then lastly, to work on this weight thing, I would have you take what we call ASAP. That's as soon as possible, as slim as possible, or as slim as possible, as soon as possible, however you want to say it. And you put a dropper full under your tongue 30 minutes before each meal, and you'll begin to lose a half a pound to 2 pounds a day. Now, the beauty of this is, as long as you stay on your program, with the 2 Healthy Start packs per month. 2 Healthy Start packs per month. That's 1 ounce of the Osteox Plus at breakfast and dinner, 2 scoops of the Anti-Tangerine Nutri-Crystals at breakfast and dinner, and 3 of the EFA Pluses twice a day. You won't gain the weight back because being overweight is a factor of nutritional deficiencies. It's a nutritional deficiencies, not a lack of exercise, not a lack of self-image or anything of that nature. Okay, Doug, let's go to a caller.
Let's head to Iowa. And Melissa, you're on with Dr. Wallach.
Hello, Melissa, you're on the air.
Hi. I was diagnosed with schizophrenia. For the past year, I haven't been taking the 90-90.
Okay, wait a minute. I missed that. You're diagnosed with what?
Schizophrenia.
I'm just not getting what you're saying.
Schizophrenia.
Okay, schizophrenia. Okay. Schizophrenia, is that correct?
Yeah.
Okay. Do you hear voices?
I think that people are stalking me, and I think people are talking about me when they aren't.
Okay, I gotcha. Okay. And are you on medication?
Yeah, I'm on Risperidone, and I'm also taking an anxiety pill.
Mm-hmm. Okay, and how much do you weigh, Melissa?
150.
Oh, and how tall are you?
5'9".
Okay. Well, here's what I would suggest to you. Number one, do not get off your medication. You must stay on your medication, okay? Did you hear me?
Yes.
Okay, you stay on your medication because the only one who can help you get off your medication are the doctors who put you on the medication. Now, with that said, I would have you stay away from certain foods. You want to stay away from sugar, okay? No sugar, natural or processed. Very important here. And do you have any history of skin problems like eczema, dermatitis, or psoriasis?
I have celiac.
You do have celiac. Okay, good. That's where I was going. Very good. So you know to stay away from gluten, wheat, barley, rye, and oats in all its forms, correct?
Yes.
Okay, but it's in hidden places, so I want you to get a hold of that CD called Serial Killers and listen to that 10 times so you know all the hidden places. But hang on, I'm going to give you a supplement program after these messages. Okay, Doug, let's go right back to Iowa and Melissa. Okay, so once you get rid of the bad things, and the sugar is certainly one of them, alcohol is another one because it's liquid sugar, then I would stay away from fried foods and processed meats and nitrates and nitrites. And again, since you know you're celiac, I would suspect this has a major cause or a major relationship to the schizophrenia, because schizophrenia is a chemical imbalance. Any psychiatrist or psychologist will tell you that, but it's really a nutritional deficiency causing the chemical imbalance. So you can't absorb things very well because you have celiac disease, and of course celiac disease is something you can manage extremely well with diet, but you have to know all the hidden places are gluten. Tomato soup, chicken rice soup is thickened with it, gravies. They put breadcrumbs and cracker crumbs in meatloaf and meatballs. You say, well, I can't eat the spaghetti, but I'll have just the meatball. Well, it's loaded with breadcrumbs. And so, do you have a dog or a cat, Melissa?
Yes.
Okay, you feeding them dry dog food?
Yes.
Well, guess what? That's where you're getting your gluten. You're still getting glutened. Okay, so you need to switch over to canned dog food. And I would stay away from the dry dog foods because they are loaded with gluten. Okay, the dust will get you. The dog lays on the couch, lays on the rug. You sit on the couch. It gets in your clothes, gets in your hair. If the dog sleeps in the bed, guess what? You're getting gluten everywhere. So you got to change the type of dog food you're feeding them because you're getting heavily contaminated with gluten through the dog food. That's why I want you to get that CD, Serial Killers. It tells you all the weird places you're going to find gluten. Then, let's see here. I want you to take, at 150 pounds, I want you to take 2 Healthy Start packs per month. That will allow you to have 1 ounce of the liquid mineral calcium mix blend that's called Osteox Plus. I want you to take 1 ounce twice a day. I want you to take 2 scoops of the Beyond Tangerine Nutri-Crystals at breakfast and 2 scoops at dinner time. And then 3 of the EFA Pluses at breakfast and dinner. That'll all be taken care of by the 2 Healthy Start packs per month. I would like you to take the Smart FX, which are DHAs and EPAs, the raw materials for the neurons, the cells in the brain, to actually make neurotransmitters when it comes to cognition, problem solving, things like memory. And I want you to take 3 of those twice a day. It's 2 bottles a month. And then I would also like you to take what we call D-stress capsules, capital D-stress, capital D like David, dash, and then the word stress. I want you to take 3 of those 3 times a day. That's 9 a day. That's 3 bottles a month. And that's going to give you the raw materials so that your brain can actually utilize energy properly, and it supports proper brain cell metabolism. And let's start there. And then call me every couple of weeks to bring me up to date. Let me know how you're doing. But do check with your doctor who prescribed your medications on a regular basis, and let them determine whether or not it's time to begin weaning off your medication. Certainly don't cold turkey off your medication, and only begin to wean off them when you get permission from the guy who gave the prescriptions. Okay, Doug, let's go to callers.
Let's head to Los Angeles, California, and Victor, you're on with Dr. Wallach.
Well, Victor, you're on the air.
Good afternoon, Dr. Wallach. Thank you for taking my call.
You bet, sir. What's up?
I've been told that I've borderline diabetic for the last 10, 15 years, but my doctor has never really put me on medication because he said I'm managing it properly. Mm-hmm. But my blood sugar is usually between 90 and sometime 130, and I've seen it up to 200. Mm-hmm. So I know there's some issues that I need to address.
Sure.
So I started on your product, the Tangerine, the Ultimate EFA, and the Sweeties. And my sugar is spiking now. I checked it the other day, and it was like 340. And I'm taking 4 scoops of the Tangerine in the morning and then 4 in the evening.
Mm-hmm. Now, we'll stop there a minute.
Okay.
Are you putting it in juice or are you putting it in water?
Just water.
Okay. I would do a diet diary because nobody's blood sugar goes up with these products. If anything, they dive. They go down. If your blood sugar is running 90 to 130, it wouldn't be unusual for it to be in the 60s. Right away within a couple of weeks. Mm-hmm. And so there's some place you're getting some sugar, and whether it's, your neighbor made you some cornbread or you're eating zucchini, and things like zucchini, squash, you go out and eat vegetables, stir-fry vegetables or steamed vegetables. They put a lot of zucchini and squash in there, crookneck squash, yellow squash. When you heat them up, they turn into sugar very quickly. And so I find that this is a very common place where people they think they're eating well because they're eating vegetables, and they don't realize that squash is a form of sugar. That includes zucchini. So you want to check that out. And I would do a food diary and see what you are eating. And let's see here. I can't imagine why it would go up because with the Sweeties, there's enough of the nutrients in there that sensitize your cell walls so that they will recognize insulin. Your blood sugar should be dropping, so there's a source of sugar somewhere in your diet. And again, it can be bread. Hamburger buns have 25% more sugar in it than an equal weight of a slice of bread. So hamburger buns can certainly be a source of sugar. Another hidden place are processed carbohydrates, things like noodles and chicken noodle soup, pasta, even picante sauce. Salsa is just loaded with sugar. And so I would leave all that stuff out and call me again tomorrow and let me know what your blood sugar is tomorrow, making sure you eliminate all that kind of stuff, okay?
It's taking 4 scoops of the Tangerine. Is that too much?
Well, how much do you weigh?
Right at 200.
I would go ahead and drop it down to 2 twice a day. That would be sort of the recommended level is 2 scoops per 100 pounds. But there's just not that much sugar. There's a lot of fruit in there, but the sugar has been removed. It's not like there's a lot of sugar in there. And so I would go ahead and cut it back down to 2 twice a day, which would be the appropriate dose, and see if that doesn't help also. Okay? Give me a call tomorrow. Okay, Doug, let's go 2 callers.
Let's stay in California and head over to Shannon. You're on with Dr. Wallach.
Hello, Shannon. You're on the air.
Hello, Dr. Wallach.
Hi. How can I help you?
Well, I'm a distributor, and I have a lady with a 25-year-old son, and apparently he's real skinny, and she said he has a quote-unquote slight case of muscular dystrophy, and he weighs about 100 to 125 pounds. And I asked all the gluten and shellfish questions, and he doesn't have apparently any problem with gluten or shellfish. He's not on any medication, but he has a hard time swallowing pills, and they're interested in liquid nutrition.
Mm-hmm. Okay. And do you know what he weighs?
100 to 125.
Okay, 125. Okay. All right. Well, certainly, I would want to ask a couple of questions. Does this kid have any respiratory problems? Does he have any, like, asthma? Does he have any skin problems, eczema, dermatitis, constipation where he needs laxatives or fiber? That would be a useful piece of information to get that for me and let me know tomorrow.
Yes.
Okay?
I asked all those questions.
And they were negative?
About bronchitis, yes. Bronchitis, asthma, rosacea, dermatitis, all that. And they said negative.
Mm-hmm. Okay, good. Well, hang on. Get your pen and paper ready. I'll give you some information after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and the 90 for Life Crusade. And Doug, let's go right back to California and Shannon. Okay, what I would do for this kid is this. First of all, even though he doesn't seem like he has gluten intolerance, it's one of the very common rails that people with muscular dystrophy or fibromyalgia, these types of diseases, have. And so I'd put him on a gluten-free diet anyway. It's going to improve, if nothing else, it'll improve the efficiency of absorption of nutrients. So I'd put him on a gluten-free diet, no fried foods, no processed meats with nitrates and nitrites, no oils. It means no margarines, mayonnaise, salad dressings, cooking oils. If he eats canned fish, they got to be packed in water, mustard, or tomato sauce, not oil. Then at 125 pounds, I'd have him take one Healthy Start pack per month. One Healthy Start pack per month, and I would divide it in half. So he's taking a tablespoon, which is a half ounce of the Osteovex Plus at breakfast and dinner, one scoop of the Beyond Tangerine NutriCrystals at breakfast and dinner, and the 3 EFAs he'd use a day. I'd just spread them out, one at breakfast, lunch, and dinner. All that would be accomplished by the one Healthy Start pack per month. I'd also have him take 5 of the glucogel capsules twice a day, 5 at breakfast, 5 at dinner. That would be, and if he doesn't want to take the capsules, he can take the liquid. We do have a liquid glucogel. He could take an ounce of that 3 times a day, be 3 quarts a month of the liquid glucogel, ounce at breakfast, lunch, and dinner. I would also have him take the selenium. That would be, I'd have him take 2 of those 3 times a day, 2 at breakfast, 2 at lunch, 2 at dinner. He will either have to take those capsules or open them up and put them in some something like applesauce to take them down. But he needs 2 of our ultimate selenium 3 times a day. It's 2 bottles a month. And then I think I'd have him take the de-stress capsules, 3 of those twice a day. It would be 2 bottles a month of de-stress capsules. And that's going to cover his basic platform, what he needs to do well and support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, muscles, again, connective tissue, ligaments, and so on. And so go there, and if you would, give me some kind of feedback every couple of weeks. Okay, Doug, do we have time to try one more?
Yeah, let's head over to Arkansas. And Fred, you're on with Dr. Wallach.
Oh, Fred, you're on the air. Speak up, sir.
25 years ago, I developed a severe allergic reaction after eating a meal, and through process of elimination, I discovered it was red meat, different types of red meat. Shortly thereafter, actually about 3 months ago, I heard a news story that this allergy to meat was possibly caused by something they call the Lone Star tick. And I just wondered if there is any validity to that.
No. Nope. No validity to that one. That's quite a stretch of reality. Absolutely no reality. Nothing to do with that unless you get an allergy to Lone Star tick and you're eating Lone Star tick. So, yeah, I wouldn't be concerned about that. But there's enough other options for getting high quality protein. You don't have to eat red meat if you're sensitive to it. You could eat eggs, and there's chicken eggs, turkey eggs, duck eggs, guinea eggs, quail eggs. You can get these weird different types of eggs at the Oriental food stores. So it's not like you have to eat one particular type of egg. And then there's poultry, there's chicken and turkey and duck, there's fish of all kinds. And so there's no particular shortage of good sources of protein. We also have our Slender Effects shake, which is a mix of whey protein, which is out of milk, and also it has some soy proteins in it, so you get a good spectrum of amino acids. And I like to make it up. If you need to gain weight, you can add heavy whipping cream to it. If you need to lose weight, the Slender Effects weight management shake, you can just throw in some water to mix it up. And also cheese, if you're not allergic to dairy products, are a good source of protein. So that's kind of the direction I would go. And just don't eat any Lone Star ticks. But thank you, everybody. You're really a great questions and testimonies. Say thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.